Researchers at the LESA Center at Rensselaer Polytechnic Institute are working to solve the camera conundrum in healthcare settings by demonstrating how a small network of low-cost, time-of-flight sensors uses speed of light to measure distances. The technology is similar to automotive LiDAR used for self-driving cars and offers an inexpensive, cameraless monitoring solution for health and wellness facilities. Camera surveillance, though useful in many situations, is not always the best option for monitoring occupants in a facility where preserving privacy is also an important function. In places such as hospitals, elder care and assisted living centers, daycares, schools, or correctional facilities. Cameras are inherently invasive and require continuous human monitoring for real-time feedback, but LiDAR can be applied indoors to interpret patient and staff movement. LESA's sensor modules use infrared time-of-flight sensing technology, or Indoor LiDAR, integrated with machine learning algorithms to provide real-time tracking of patient pose and movement without a human in the loop. Rather, the sensor system constructs a dynamic, low-resolution 3D map of people and objects in the room. The system accurately counts and tracks occupants, detecting changes in position in real time. Unlike RF-based monitoring systems that can have limited occupancy resolution, infrared light-based LiDAR signals do not penetrate walls and can accurately monitor the movements of multiple people in a small area. By training the sensor network to recognize normal movement patterns for a wide variety of typical patient activities and patient-staff interactions, it will be possible to automatically report abnormal activities or identify issues as they occur. The Patient Safety and Protection System being developed at LESA tracks, logs, and learns the specific behavior patterns of patients and can recognize deviations in their daily activities. It understands and makes inferences on what is typical for a patient or occupant in a particular room or space at any given time. The sensors can track precisely where the patient is in the room and determine if the activity is typical. Is the patient lying in bed or sitting too long in a favorite chair? It can also track the frequency and duration of patient-provider visits, which ensures that patients are attended to as required and reduces human error in reporting and recording patient checks by providers and healthcare staff. The information collected may also be important to insurance providers, or may need to be integrated into electronic medical records for compliance in meeting specific care criteria for a patient. The system can continuously track and monitor people as they move around the facility. The PSP knows how many people are in any given space at any given time, and then makes smart predictions based on their trajectory of movement. At a memory care center, for instance, patients go into the dining room every day at 6 p.m. for dinner. But a patient who forgets where she is going at 6 p.m. and inadvertently wanders off into another part of the facility is immediately flagged as a deviation that needs attention, and a healthcare provider is notified so that she can be brought back safely and before she gets lost or hurt. Since the sensors do not require a wearable apparatus, it does not matter if the patient is cognizant enough to remember how to use it or if she is wearing one at all. Having the PSP send alerts for deviations, such as someone falling, would have fewer instances where someone was unable to get up right away or call for help. Bathroom slips and falls are among the top causes of injury for elderly, and 85% of all domestic accidents occur in the bathroom, a place where preserving privacy is integral, and having camera surveillance would be an invasion of privacy. The PSP, however, can detect falls in places camera surveillance would be inappropriate, and alert personnel in real time to render aid. When an abnormal deviation is detected, the system autonomously and instantly notifies personnel if the situation requires caregiver inquiry or intervention. Citing an Associated Press article that prompted a push for health facility video surveillance after an incapacitated female patient gave birth, LESA researchers believe the PSP could have stopped or prevented this type of interaction that occasionally occurs in long-term care facilities. Perhaps most significantly is that LESA's proposed occupancy tracking system offers an extremely effective alternative where laws may be too vague or stringent on the use of electronic camera surveillance in the healthcare setting. Continuous camera surveillance in general is not HIPAA compliant, and the Electronic Communications Privacy Act, which regulates how an individual's personal data can be retrieved, stored, and distributed, can make facility administrators shy away from monitoring altogether. A camera-based system can provide a lot more information than non-camera systems, but at the cost of invading patient privacy and requiring full-time monitoring by another person. LESA's Indoor LiDAR approach to occupancy tracking, however, can be designed to automate patient monitoring and report results directly to supervisors, record staff monitoring of patients, while simultaneously updating electronic medical records and freeing staff to do what they do best: provide patient-forward healthcare.